Okay, we have a lot to cover today, so we're going to go ahead and get started. Thank you for joining our August PO monthly call. This is the second of the two, so we're going to dive right in. So we're going to talk today about the final primary care VBR for both new and continuing practices. We'll then talk a little bit about the continuing PO, physician organization scorecards, and then we'll talk about a couple of different ways that POs can get involved and earn some early VBR credit. And as a part of that, Laria Young, a design project manager, will be joining to talk a little bit about our new Dashboard 2.0 and some ways for you to give feedback as we look forward to its launch. So diving right into our primary care physician VBR, so the measurement year and the reward year for this, as a reminder, is September 1st, 2024 through August 31st of next year, 2025. So the notification for this, for the eligible primary care physicians, is changing just slightly. In the past, we've shared those physicians that Blue Cross has let us know are ineligible for VBR prior to the September 1st start date. Blue Cross has asked us now to hold off sharing this information. The primary reason was for a physician not being eligible for the VBR was that they are not included in that fall 2023 PGIP list. They do have to be in that PGIP. They have to be PGIP eligible for a year. And Blue Cross does want to disseminate that directly to the POs so that any and all questions regarding eligibility can be directly directed to Blue Cross rather than going through MCTTD. So you will still obviously be notified of any ineligible providers, but that messaging will come directly from Blue Cross. All right, so we're going to start out as far as the scorecards are concerned with our practice VBR. And so I'm going to actually scoot over to our admin portal for this portion, and we'll come back to the slides in a minute. So let me make sure I'm sharing the right thing. Yeah. So in the admin portal, and we're going to use Michigan Medicine's portal today as an example. They've generously agreed to let us show their scorecards. When you log into your account, you'll be able to see, as always, your organization's logo on the top left, and then you'll be able to click on your scorecards. And so the scorecards are located on the nav bar on the left here. So we're under the practice scorecards. And then you'll see here that all of your participating practices are listed out. And you're going to have both new and continuing practices. So continuing meaning that they were previously enrolled, and new being that they were enrolled with this most recent recruitment cycle. So to look at each individual practice's scorecard, you just click on that practice. We're going to start with looking at a new practice. And so we'll click on this one here. The first thing we'll call out to right now is that this has changed just slightly in the way it's administered. So in the past, things on the scorecard itself was all or nothing. Now there is a certain scoring to it, as in that you don't have to get 100% of the points to still meet the scorecard criteria. So you'll see at the top here that the minimum required score is now 80, with maximum possible score is 100. And you'll see as we go through the items in the scorecard that it's broken out by certain point levels based on certain criteria. So the first one here is pretty simple. It's what I'm sure you're all familiar with, is just the identification of the clinical champion and the practice liaison. Almost all of you have completed this already. This is vital because it allows us to disseminate all of the practice level information, including the practice change readiness assessment that will be coming out shortly, directly to the clinical champion and that practice liaison. You'll notice here on the right, our scoring for this is segmented by date of completion. And so if that's completed by September 1st, you'll have all 5 points for that. If it's completed by October 1st, you'll have 2 points. And then if it's completed after October 1st, that's no points. Moving down the list here, we have the rest of our criteria here. So number 2 is complete the MCTTD practice change readiness assessment. That'll be distributed, like I said, to the clinical champions at each practice directly via email. And we will send, as always, a number of reminders to help out. We have removed a few questions from the previous practice change readiness assessment and moved those questions over into different surveys as appropriate. So it is a more streamlined practice change readiness assessment. Hopefully that alleviates some of the burden on practices. But we'll talk a little bit more about its dissemination when we get back to the slides. The next item here is each physician completing a physician level survey related to their knowledge and comfort levels with MCTTD initiatives. So this is one of the areas where some of the questions from the practice change readiness assessment may get redistributed. We had received feedback that practice champions weren't necessarily comfortable making blanket statements for all of the physicians in their practice about their comfort level prescribing some of the MCTTD initiatives, the medication, CGMs, low carb, eating patterns, things like that. And so we did this at a more physician level rather than at an entire practice level. And so that's just one example where some of those questions could be redistributed. And that makes up 15% of, or I'm sorry, 10% of the overall scorecard here. So that is segmented, excuse me, by completion rate. So if 90 to 100% of the physicians within a practice complete their physician level survey, you'll get all 10 points, moving down to 8 points for 80 to 90, 89, 5 for 70 to 79, and less than 70% complete is 0. All right. Next here is Practice Clinical Champion completes all 4 MCTTD training sessions. These are going to be offered live and recorded. So we are re-recording them, which is why we're offering them live again, just to make sure that we're updating our content. There will be both CME opportunities and credit for the scorecard associated with attending either the live or the recorded session. So that's slightly new for us. In the past, we've only offered CME for the live sessions, but for these 4 MCTTD trainings, the CME will as well be offered for the recorded sessions. So that's an important distinction. Again, some segmenting of the scores on the right: 15 if completed by December 13th, 7 if completed by January 31st, and 0 if completed after 1/31. All right. And so the next one here is distributing the patient needs assessment and collecting a minimum of 10 responses to that. And so this is something that's currently under development, and the requirement along the is kind of paired with the next item, item 6 in here. So the expectation will be that practices disseminate the survey through flyers to patients. MCTTD will collect those survey responses through an electronic data capture system and then disseminate your practice's responses back to you, the practice, and then the practice will be expected to submit a report back based on their practice needs assessment results, including analysis on gaps and practice level goals to address some of the issues that have been raised by their patient population. And so you can see again the segmenting of the scores: 15 if we received those 10 responses before December 31st, and then on and down based on survey responses, number of survey responses. For the practice needs assessment gap analysis and goal assessment, that would be completed. You'd have a couple of months after the responses have been completed and then disseminated back to the practice to provide that type of analysis and reporting. If completed before February 3rd, you'll get all 10 points. Before the 17th of February is 5, and then after the 17th is none. And then, as per usual, attending the spring 2025 in-person regional meetings, expected that the practice clinical champion attends or sends a delegate in their place if they're unable to attend, with the expectation that attendee is a clinician of some kind. And then that is an all or nothing, a 15 or nothing for attendance. The physician level learning community requirement is staying the same as it has been the last couple of years. We'll continue to offer a vast number of different opportunities to meet this physician level learning community requirement. And then this will be announced as they come out throughout the year. As you know, we host a learning community events where we have a special topic that a content expert will speak about, or providers can review a tool and provide feedback on tools or different one-pagers, and that is another way to meet it. And there'll be numerous and often as far as the opportunities to complete this, but stay tuned as we'll announce them as they arise. The practice level learning community requirement, this includes, again, a number of ways that you can meet it: providing feedback in partnership with a patient on a patient-focused tool, so really facilitating that patient feedback from a patient of your practice, or participating in a work group, giving input via user experience session, which Lauria will talk a little bit more about in the second half of the meeting today. And there'll, like I say, be additional options to complete this as they arise throughout the measurement year. And the last one here for the new practices is meeting the PO level learning community requirement here. So this is something that you as a continuing PO is very familiar with, except for maybe our two new participants, participating POs. So again, we offer numerous options for meeting this. This can include presenting at a collaborative wide meeting, presenting on a panel at a meeting, or either virtually or remote in person. Participating in a steering committee, additional patients to the patient advisory board is another way to meet it. So lots of different options, and again, we'll announce more as they become available. Okay, I'm going to switch briefly back to our slides here, and we're going to talk just a minute about the deadlines on some of these things. Slideshow, I'm sharing the right thing. All right. So upcoming dates, just to rehash for new practices. So 8:30 is the date to have all clinical champions and practice liaisons identified. Like say, the earlier the better, but like say, I think most people have already met that. By September 3rd, we'll be sending out the welcome email and a practice change readiness assessment to all of the new practice clinical champions. To give a little bit of time to not spam everybody's inbox all at once, we'll wait until September 9th and then send out the physician level assessment distributed directly to those due practice clinical champions and PO leads. And then the expectation will be to have the dissemination plan in place by December 13th, 2024. So great question from Kathy in the chat. This is going to go live by the end of the week in the admin portal. So the idea was to present it at these meetings and then push the button and let you guys have access to it right thereafter. So you should see it before the end of the week. And then Chris, question in the chat: can the PO see the assessment, the practice, the patient needs assessment? Yes, we'll disseminate the patient needs assessment to both the practice and the PO, and the results of that will be provided to both. Yes, I assume that's what you mean by see the assessment, or if you mean like the raw assessment, we could also practice. Either way, we can send both the raw questions and the results of it to both the practice and the PO, if that would be helpful. That's fine. Yeah. Does that answer your question, Chris? Yep, that shouldn't be an issue. And reach out via email if you have more questions, or we can send PDF versions of those for you. All right, and then mid-September, patients needs assessment distributed to the new practices and the POs, and then like say have dissemination plan in place with 10 responses back by December 13th of 2024. Okay, so there are a couple of new resources here that we have been working on, and that are, one is currently available and another one will be coming soon. So we've created a 7-minute introductory video for new clinical champions that really explains the role of what a clinical champion is, what is your responsibility for participating in MCTDA. We're hoping that this is a helpful resource, not only just for new practices, but also potentially for existing practices and POs to use as they're recruiting individuals and practices for participation in MCTDD. And I believe Jackie just put that video in the chat for anybody that would like to save that. We are also working on a 4-minute intro to MCTDD video. This will be included as a link in the practice level, or I'm sorry, the physician level assessment, and that'll be coming out in about 2 weeks. All right, so I'm going to pause here. Actually, you know, let's do the CGM user experience program here real quick first. So another way to meet the physician level learning community requirement is to meet or to participate in the CGM user experience program. And this is really just an FYI for new enrolled POs. I'm assuming most of the existing POs are familiar with this, but we really just wanted to call this out and make sure that this was a known option. So if you're not already familiar, the CGM user experience program allows providers, including physicians, physicians and advanced practice providers, such as nurse practitioners, physician assistants, and pharmacists, anybody with clinical prescribing ability, to wear a CGM themselves, with the intention that it can help them understand the patient experience, help them feel more comfortable with explaining what a CGM is and how it functions to their patients, and really kind of allowing them to get that hands-on first-person experience. We do these orders in batches. We have to order them directly from our CGM partners out of it. And so it can take up to 2 months sometimes to receive your CGM, depending on the speed with which our order gets placed. It gets shipped to us, and then we're able to box it up, and also depending upon the demand. And so depending on the influx of new orders, it can take a little bit of time. We just want to make sure to call that out so you don't get frustrated or feel like your order may have been missed. If you do feel like that and wonder if you did get missed, feel free to reach out to me and I'll double check, but it hasn't happened yet. Like say the requesting for participation in the CGM user experience program is available. I just saw your message in the chat, Chris. So to your question, how do you request to participate? On the MCTTD website, if you go under the members page and select your role as a physician, one of the options there on that page will be the CGM user experience program. If you click into that, it'll have a whole dedicated website or web page on our website, excuse me, that tells you step by step how to participate in the program. It'll include a link to the sign up form. The steps for participation are pretty simple. You sign an interest form. After the interest form is signed up, you'll get an email with a link to the CGM training. And the CGM training is required associated with participation in the CGM user experience program. If you're a clinical champion, you're going to have to watch that CGM training as a part of your 4 required MCTTD trainings anyway, so it's kind of a double dip there. But if you're not a clinical champion or just a regular or an APP, for example, out of practice, then you'd have to watch that training and sign an attestation form. That's what allows us to do this training as a off-label experience. And so after that attestation is signed, we'll get a queue to put you in line to get one shipped out to you. And assuming we have them in stock, we'll ship it out to you fairly quickly. But sometimes, like say, if they're on order, it may take a little while for us to get them in and then batch ship them out to everybody that submitted that attestation form. All right, pausing for a second because we're going to switch to the continuing practice VBR. So I'm going to go back over here to our forms here. And Susan, is there a follow-up survey? Yes, there is a follow-up survey associated with the CGM user experience program. It is very short. It is not, it's really just asking about your experience, what you thought about it. Did you feel like it was helpful? Those types of things. The follow-up survey should take less than 5 minutes, potentially just a minute or 2, and is required in order to finish that loop and get your credit for the VBR. Thanks for that pin, Susan. All right, another question. You mentioned for 4 trainings for clinical champions. Can you remind me what and when those are, the list? Okay, so yes, those are going to be 1 training on each of the 3 MCTTD pillars. So CGMs, guideline-directed medication prescribing, and lower carbohydrate eating patterns. And then the 4th will be tying them all together. How do we utilize these 4 strategies in tandem to create a care plan for patients with type 2 diabetes? So they are available on demand, yes. They will be available both live one time and on demand. And the VBR credit is available both for the live and on demand sessions, as well as the CME. CME will be available both for live and on demand session, those 4 trainings. All other recorded sessions of like learning community events, CME will only be available for the live sessions, not the recorded sessions, but for the trainings, which are slightly different and required, the CME will be available for the recorded sessions. All right. Keep putting questions in the chat as they come up, but I'm going to move over to our continuing PO scorecard here. Where can we find them? So we're in the process of re-recording them right now. The new versions will be posted this fall. So for our continuing practice scorecard. So we have two separate sections of this. We have our participation measures, and these are going to be things that you're pretty familiar with. These are things that you completed many times in the past if you're participating in continuing practice. And so these include things like attending the regional meetings. So the fall ones, as we know, are required for the continuing POs this year, and those will be virtual, as we've already discussed. And then spring will be in person. So that's the 25 points for attending both the virtual fall and in-person spring. And then the next one here is meeting that physician level learning community requirement. And so, like we talked about, we'll have a number of different ways to complete this: attending live MCTTD educational webinars, viewing recorded versions of that webinar, or providing feedback on any provider facing tool, for example. And then you can see the breakdown of the scores on the right there for completion. And then meeting practice level learning community requirement here. So this is just whether or not the practices have met this requirement. That practice has met the requirement, excuse me. And then finally, meeting the PO level learning community requirement, very similar to the new practice ones for these participation-based measures. And so the change, what's new, is this new performance measure that we've talked about with you guys. And so this is where we'll be kind of going our first foray into a performance measure. And so you can see that these are broken up by the percent VBR. So 3% of the VBR will be based on the participation measures, and 2% will be based on the performance measure. And so that's what this 102 versus 103% is really alluding to. And so, as you guys are familiar, because we've talked about this a couple of times now, our performance measure is going to be based on the HEDIS 90th percentile rate for A1C, for less than 8 for commercial patients and less than 9 for Medicare patients. The measurement period for that will be September 1st, like we said, of 2024, but then we'll be stopping slightly before the end of the performance year for the measurement. We're stopping right there on March 31st. This will allow us to do the end measure calculation in time for the end of the measurement and payment year. The baseline period for the data that will be collected in order to be able to have a starting point will be from November of 2023 through May 31st of 2024. Just a quick note, pretty much everybody, I think everybody actually, is already meeting this. So the effort here is really about maintaining performance. And there's a couple extra very minor tasks associated with practices that are already meeting this requirement. So if you are already above that threshold and doing well, in addition to just maintaining, the first task will be to review the charts of 10 patients with an A1C over 10 and report on key drivers of control. And then task 2 will be to participate in a cohort working on submitting GMI or time in range from CGM reports for patients that do utilize a CGM. And then the last thing to note here is that this will be at the practice level, with the exception of practices that have less than 100 patients with an A1C. Those practices will roll up to participate at a PO level, and there'll be more info about that forthcoming. All right. Pause for a second. Questions, comments on the continuing practice scorecard? All right. So we're running short on time here, but we're going to try to go as quickly as possible. I'm going to go into our PO scorecard now. So go over to PO scorecard on our nav panel here, and we can see our 2024 to 2025 scorecard for the physician organization. So these should all look relatively familiar to you guys as well if you're a continuing PO. So the first one here is the PO practice recruitment and participation. This is the one new item. So previously, Blue Cross had done this separately with requiring POs to meet a certain number of patients with type 2 diabetes throughout their PO and enrolling a number of practices to cover a minimum number of those patients. So 25% of those patients have to be covered in your participating practices. So this is now rolled to the physician organization scorecard. So you can see on the right there that you get 50 points if your participating practices represent at least 25% of the total PO's type 2 diabetes population. And you can get 25% if you are greater than 10%, but under that 25% mark. But then anything under that 10% would represent a failure to meet that portion, and that would failure to meet that would mean that your PO is not eligible for any PO reward. That's how it was in the past, but it's just now spelled out here in the PO scorecard. Additional items here, and I apologize, I'm going to go a little quickly because we are getting short on time. The PO meeting, attend the PO meetings like you are right now. Number attended and the point value associated with that is on the right. Attending the MCTTD small group PO discussion. We will be creating small groups of like POs to convene discussions about different topics associated with MCTTD initiatives. So we'll provide general topics and the facilitation of those meetings, but the calls will really be discussion based and led by you as the POs. Attendance with active participation is 10 points or 0 for no participation or attendance. Attendance at the June in-person collaborative meeting as per usual, ensuring that you have a PO level administrative lead, clinical champion, and data contact identified and listed within the admin portal. We will identify and or notify you if you have been identified as missing one of those contacts, and then you'll have about a month to identify a replacement role. Designating separate practice clinical champions for each practice. And instead of having one person fill this role over multiple practices, if you do have previous exceptions in place with MCTTD based on unique practice structures, those will continue to be honored in certain scenarios. Or if you have greater than 95% of your practices in integrated health systems enrolled in MCTTD, coordinating center will work with you to develop an individualized plan. Next, ensuring that roles and contact information for the primary or for the clinical champion and practice liaison are current, accurate, and complete. So this is just making sure that they're updated and kept updated throughout their participation. Participating in one of the following focus groups, and that's what Laurie is going to talk about here in just a moment, and completing one of the activities listed under the PO level VBR options. And then finally, meeting the target MCTTD performance metric related to the A1C control. So I know I went through that really fast. I apologize, Lauria. I'm putting you on the spot time-wise, but I'm going to turn it over to you to talk a little bit about those opportunities.
No worries. Thank you, Jake. I can go fast. So as Jake mentioned already, we're really excited to be sort of in the very last stages of releasing two major changes to our dashboard. One is a completely redesigned summary measures page, which you can see a preview of here. And one is an all new landing page and way for you to navigate our dashboard. We developed these using your feedback that we collected through all of our one-on-one calls with members, and we tried really, really hard to incorporate all of the things that you asked for. We want to be able to continue gathering your feedback as we continue to develop and update this page. So to do this, we are going to be hosting 3 separate focus groups targeted at different releases of the dashboard. The first is going to be in September, October in the fall, and it will focus a lot on the summary measures release. And as the PO users, we know that you guys are the ones who most regularly use our summary measures. And so we want to make sure you're a primary user included in these focus groups. We will be offering another one as well in December, January to review the patient list and patient profile release. And then in March and April to review pre-populated reports and a couple other features we're working on. So Jake, if you can go to the next slide. We are asking you to vote right now for some available dates for that September, October focus group. You can scan the QR code on your screen. Just know we were having some issues with the mobile version of the website, being able to scroll down and see all the time options. So I've also included the link in the chat for you if you want to click on that and do it on your desktop computer. And let us know if you have any questions. We'll be sending out calendar holds for that shortly once we collect this group's availability. And we really, really look forward to having you participate and hearing your feedback on these new pages. All right, Jake, I'll turn it back to you.
Awesome. All right. That is the end of our slide deck, and we're right at time. I have a question in the chat here. Is this for admin or clinical champion? Go ahead, Larry.
It's open for everyone. Jake, I don't know about the scorecard requirements in particular, if there's any other information you want to share there, but the focus groups are open to anyone who's interested in participating.
Yeah. So it would be somebody participating at the PO level for your PO's requirement. And so you'll be able to see in that PO scorecard here, meet the complete one of the following activities, have a PO admin lead, primary contact, or clinical champion present. And so any of those roles would be sufficient for this PO requirement.
Great. Thank you, Jake.
Right. Any other final questions before we turn it over to email?